It's every parent's desire for their child to have a great start in life. Yet there is a condition affecting more children's lives than pediatric cancer, diabetes, and AIDS combined. Autism strikes 1 in every 150 children between the ages of 3 and 5. Considered a pervasive developmental disorder, there is no conclusive data on what causes autism, but there are certain red flags a parent can watch for.
Some of the red flags that parents should be looking for in their young children as they're developing are lack of eye contact with parents and other family members, lack of response to the child's name. So if you call your child's name and they have no response, or it takes many times to call their name before they have a response, that should be a bit of a red flag. And a lack of the emergence of any vocal speech at all. By the time your child's 1 or so, they should be saying at least some words or making some attempt to speak. If that's absent, that should be something that you're concerned about. And finally, a big red flag is the presence of a lot of very repetitive behavior or very restricted interests, things like flipping light switches on and off over and over for a long time, spinning around in circles over and over for a long time, turning toy trucks upside down and spinning the wheels while you stare at them.
Oftentimes, these developmental delays can cause children with autism to have challenging behaviors and frequent tantrums.
Our household was in chaos all the time because this child had to be watched constantly. He never stopped moving. He stopped communicating. He spun in circles, banged his head against the wall, hurt himself, hurt me. I used to have to put makeup on my arms to cover the scratches from his tantrums were horrific.
To help overcome this reaction, many parents are turning to early intervention programs designed to help address their child's specific needs. One scientific theory to learning is called applied behavior analysis, or ABA. It's one of the most researched and effective ways to treat autistic children. Dr. Doreen Grand-Pichet, a 30-year veteran in the field, explains how these principles can improve the symptoms of autism and, in many cases, help cure the disorder.
Behavior analysis works by reinforcing appropriate behaviors and teaching the child to replace inappropriate or challenging behaviors with behaviors that are more appropriate, and then rewarding those so that the child behaves more like typically developing children.
The hardest thing to get is eye contact, to make such a little guy actually look at you and that you know that he's there and he's understanding what you're saying. The first skill was the eye contact. Enzo has made in 2 years huge improvement in that realm. He is finally looking at you when you call his name. Just when you say, Enzo, Enzo, where are you? For him to say, I'm here, it took like hardcore drilling for that. Now he's joining in social skills as in playing with other kids at school.
The Center for Autism and Related Disorders, also known as CARD, is among the world's largest and most experienced organizations treating autism and similar conditions in children today.
When a family comes to CARD, this becomes the child's second home. These are people who become very involved in the family, very involved with the child, and they truly enjoy watching the child improve and learn and master all the skills that are being taught. So we establish this sort of support system for the family at the same time that we're teaching the child, and that's partially why the children do so well with us.
Since the 1990s, CARD has been dedicated to significantly improving the lives of autistic children and their families.
Now we can do family outings, we can go places. I can go to the grocery store without fear that my son's going to have a giant tantrum and people are going to look at me like I'm a horrific mother because they don't know my son has autism.
CARD also offers comprehensive intensive ABA services for individuals up to the age of 21 and has specialized outpatient services to address specific challenges such as feeding problems.
CARD SOS, which is CARD Specialized Outpatient Services, has a feeding clinic. Basically what we've done is we've put together this package wherein children will come to the office and receive services from a clinician, and then once we've treated their feeding problem here, then what we do is some parent training wherein we get them to now start feeding the child both within the clinic and then within the home setting.
Physically devastating for a child and emotionally exhausting for a parent, autism can cast a cloud on a child's future. Applied behavior analysis is an early intervention program that is scientifically proven and has shown great success in the majority of autistic children and has even led to full recovery in others.
If I go by my experience, parents with an autistic child should definitely use the services of CARD, because without CARD, I would not have my life back and my son would not have the chance to be like everybody else like he does now.